What is vaginal repair surgery and vaginoplasty? Vaginal repair surgery, also known as vaginoplasty or pelvic reconstructive surgery, aims to restore and tighten the vaginal muscles and tissues. This procedure is often considered for women who have experienced childbirth, aging, or other factors leading to the weakening of the vaginal structure. The surgery involves the removal of excess tissue, repair of any tears, and the tightening of the vaginal muscles to enhance both function and aesthetics. Common reasons for vaginal repair surgery: post-childbirth changes. The birthing process can cause stretching and tearing of the vaginal tissues. Vaginal repair surgery helps in reversing the effects of childbirth, addressing issues like vaginal laxity, aging, and hormonal changes. As women age, hormonal fluctuations can lead to a loss of elasticity in vaginal tissues. Vaginal repair surgery offers a solution for women experiencing discomfort or dissatisfaction due to these changes, enhancing sexual function. Some women opt for vaginal repair surgery to enhance sexual satisfaction by restoring tightness and improving overall vaginal tone. The surgical process. Vaginal repair surgery is typically performed by a skilled gynecologic or urogynecologic surgeon. The procedure may involve the removal of excess tissue, repair of damaged areas, and the tightening of the vaginal muscles. It can be done using traditional surgical techniques or minimally invasive approaches, depending on the specific case and patient preferences. Recovery and aftercare. After undergoing vaginal repair surgery, patients may experience some discomfort, swelling, and restricted activity for a certain period. However, with proper post-operative care and adherence to the surgeon's instructions, most women can resume their normal activities within a few weeks. Remember, consulting with a qualified healthcare professional is crucial to determine if vaginal repair surgery is the right choice for individual circumstances. Thanks for watching. Follow us for more.